As our member centers evolved through the many years that they've been in service, they ran into different challenges. The first challenge was on the financial side. FQHC health centers do not transmit claims just on fee-for-service. They truly are a very complex animal of healthcare. So as we started looking at our first major business opportunity was how do we make the business process more efficient? So the end goal is obviously patient care and better outcomes, but we have to keep the lights on in order to keep our practice running. We wanted to find an electronic health record system that was one system. We didn't want to create interfaces between our practice management system and our electronic health record system. We didn't want to have to teach the vendor how to do it. The second major item is to make sure our providers have access to their data anywhere they are. We have providers that sign off on their labs and issue prescriptions from Ghana, Africa, because they can access our system from anywhere. When you're in a paper system, you are truly locked down to wherever that paper record is located. I think that the core components of a good practice management system is the ability to track your cash and your appointments and the clinical process all in one circle. The finance folks want to focus on the cash. The billing folks want to focus on adjudication. The clinical folks want to focus on outcomes. And then you have the folks running the business focusing on the actual workflow. So a good practice management system allows you to tie all those together. The reason we ended up picking Sage Intergy Suite, we felt it was the strongest electronic health record system on the market. And we also felt that Sage had a vested interest in our business unit. We knew they had the largest implementation of federally qualified health center software. We knew they weren't getting back in the market to make these major wins financially. We knew that they understand the mission of our health centers. They've always been there to support us.
There were a number of reasons why we decided to go with Sage, and that would be a long list. But kind of looking at the ones that were most important to us, high up on the list was finding a vendor that had been around for a long time or had, with a product that stood the test of time.
We actually have our colleagues at Sage that understand the UDS, understand FQHC wraparound, understand split programs. So we're not teaching them what the process is. They've been with us for 10 years. It's been a great process to have a partner that understands FQHCs and have vested interest in the FQHC market, not just as a stakeholder type solution, but truly as an integrated partner.
We looked at many different products and we're very excited about the fact that this presented a Windows-based, very user-friendly product that would at least help shorten the learning curve for our clinicians.
We believe the implementation process at Health Choice Network with our partner at Sage has been very successful. It's actually been quoted as being one of the best practices in the market.
Sage has done a great job in working with us to create a product that really meets our needs and continue to work with us in a way that has been very collegial and very satisfying.
From the Intergy Suite perspective, we now can run UDS on a daily basis if we would like, to make sure that we're meeting the requirements of our federal and state grant. So if I'm a homeless health center, I want to know how many homeless patients I saw yesterday. And I don't want to just see it from a report perspective. I want to see how the feds are going to see it. So now with Intergy allows us to run these reports at will and be able to present the data so that way centers can make change based on real facts, not just opinions.
There are quite a number of unique ways in which we use a Sage Intergy product that we're very excited about. But the one that we always talk about is the development and utilization of customized templates.
In our system, we have about 300 primary care templates that are already set up for a variety of patients so that the family physician who sees an adult patient who has diabetes already has the basic questions that should be asked, the history, the physical exam that should be provided, and the services that should also be rendered.
Because we've been able to create customized templates that are user-friendly for the clinicians, as well as received a number of templates from Sage, clinicians have realized the benefit of enhanced and facilitated and fairly speedy documentation using those templates.
There are patient education information that's embedded in the Sage software so that you can print out something on how to take care of your child who has a cold and a fever. There's medication, prescription information that's very, very valuable to the patient as well.
These templates are created with input from different clinicians, and they have built into them a knowledge base that, for example, guide clinicians in what questions to ask a diabetic, for example, or an asthmatic patient, all of which then help you to come up with the right recommendations for treatment.
Another benefit of the Sage EHR system is with e-prescribing.
The potential for medication errors from prescription writing is significant. And so the ability for this product to be able to help generate a list of medications that can be used for a particular kind of condition and enabling clinicians to select from it already is a step.
It checks for drug-drug interactions automatically. So we family physicians don't have to remember what 5,000 drug-drug interactions exist today. It's just automatically done for us. So it's a terrific service for us as family docs.
Just being able to receive labs and efficiently being able to navigate the patient's record, to be able to decide on how to react to abnormal labs, has been very efficient for us. Sage
makes that really easy in this task section where all the orders that come back automatically are entered into the EHR system, and then they're listed for us as family physicians to go in, to pull that up, to check it off that we've seen it, and for anything that is abnormal, to have a way that flags it for us that we need to see that right away.
Being able to look at what tasks, labs, prescription refills, and stuff like that they're required to work on, what orders are supposed to be completed, what nodes are supposed to be completed and pending, all in one view. Really been very positive for the clinicians.
Well, FQHCs truly do the mission. We're just here to facilitate it. And FQHCs see one of the most vulnerable populations we have in our country. They come to us sometimes with no money and no resources and no eligibility to an insurance plan, Medicaid or Medicare or otherwise. So our health centers have to be able to manage these patients more efficiently than anyone else.
It's very difficult to optimize patient care if you're on a paper-based system. And Sage, with its electronic record systems and its automated reports, allows you to decide what is most important for you to achieve in the way of patient outcomes. And with Sage, it really makes financial reporting a pleasure and optimizes finances for a practice.
The reason I love practice analytics is it presents the data in a very GUI, user-friendly environment. So we can teach management, finance folks, billing folks, clinicians to run their own reports. Practice analytics allows you, the end user, not to have a programming degree or an informatics degree on how to get data out. So imagine one tool that allows you to pick the patient from an appointment perspective and follow the patient all the way to the clinical outcome.
If you're an adult practice, you have a large number of adults and older adults, you may really want to focus on how am I doing in taking care of my patients with chronic conditions? How are my diabetics doing? How are my hypertensive patients doing? Am I getting their blood pressure under control? Or am I getting their lipids to the right level? Sage allows you to develop easy-to-use registries where you can track your performance and then focus the efforts of your office staff in reaching out to the patients who really need to come into your office to get perhaps a change in their medications, more education, and in that way assure that you're providing the patient care that you hope to achieve.
We have an opportunity with technology to solve some of the basic challenges with healthcare.
I think fundamentally, having the Sage EHR system in your practice really allows us as physicians to optimize the patient experience in a number of ways. First of all, when that patient comes into the office, they have confidence that they will receive the services that they should based on their age and their gender. It gives them a sense of confidence that the physician is really practicing in the 21st century using the latest state-of-the-art tools to improve patient care.